Good morning, everybody, and welcome to the St. Louis podcast. I'm your glorious host today, Eric Brown, president of Vi Media and partner at Mogul Holdings, sitting next to Garrett Atkins, previous CEO of Vi Media and currently CEO of Mogul Gaming, which is a family of video game journalism and tech companies such as GPT Gaming News, VGT Gaming News, and other acronyms with gaming news as well in there, reaching over 100 million people a month. Or is that approximately? Whatever. A bunch of people. That's a good number. All right, today we have Avery and Jamie with the American Cancer Society on the St. Louis podcast, and we're going to get into the weeds with them and the organization. But before we do, this is the St. Louis podcast each and every Friday, 7 a.m. You know it. We drop a podcast episode. If you're listening now, please like, review, subscribe, share with a friend, leave a comment. We appreciate the support. Let's jump into it. How are you both doing today?
Good. Real good. Thank you.
Thank you for having us today.
Absolutely. Besides the 5 inches of rain we're getting outside, we're doing good. So, talking about an important subject today. So just a little bit of background on American Cancer Society. What I found interesting and I thought would be a good point to start is, okay, back up. So many people think that it's an endowed organization, which it's not. So underwritten in perpetuity by a single wealthy benefactor, person, family, or corporation, which is not true. So it's pretty much funded by personal donations from people listening to this podcast right now. And in 2022 alone, you guys invested over $145 million in cancer research. Since 1946, you guys have invested more than $5 billion in research grants to the best scientists across the country. Now, one thing I've found interesting is that it says that you guys say nearly half of all cancer deaths are preventable. So I'm curious if we could start there. So are we talking about, so obviously you guys have the prevention side, right? And then you guys actually funnel, of course, money for the treatment and then to actually help people going through cancer treatment as well. So let's start before you have, cancer. How can you hopefully avoid it or prevent it for as long as possible? So you guys say nearly half of all cancer deaths are preventable. So where does that metric come from? Curious.
Yeah, absolutely. So I'll kick it off and then I'll pass it over to Jamie because Jamie's very passionate about this topic. But early detection and screening is key to finding out even if you have cancer, if you don't have cancer. Specifically in the breast cancer space, mammograms beginning at the age of 45 or earlier if it's recommended by a doctor. But early detection and screening, getting your pap smear or your colonoscopy whenever it's due. That can help us, one, find it if it's there, and we can find it at an earlier stage so it's easier to treat. But making sure that we're just seeing if anything's there, I talk with a lot of people that are scared to get screened. I was previously scared to get screened as well. But
as a guy, colonoscopy sounds horrible.
It does sound not fun,
terrible.
but what sounds even worse is going through treatment longer than you needed to because you waited to find for the answer.
Very true.
So, whether it's there or not, the screening is just going to tell us. And so it gets us that answer sooner so that way we can treat faster and better. But Jamie, if you have anything to add to that.
Just to piggyback on screening and even just being aware of your own body and making sure that you're checking yourself. I was diagnosed with cancer at the age of 29. And it's only through breast self-exam that I was able to find it.
Yep.
My husband is also a testicular cancer survivor. So that was also found. So understanding if you have a partner, your partner looks at your body.
Yeah.
So encourage that partner to be like, what's that?
Yeah.
Let's look at that. Let's keep an eye on these things. So being able to have that conversation with your partner and just be open about your health and share those kind of things. Like, hey, can you come look at this with me? Can we mark down like when we looked at this and approximately what size it was? Because then that helps you when you go have a conversation with your physician.
Yep.
I can't imagine if I would have waited till the age of 40 to have my first mammogram.
That's what I was gonna say. So it's recommended at what? You said 45?
45 as of right now. Yes.
Well, I hear all the time of 20 and 30-year-olds getting breast cancer now. So it's like, should we not be starting that way sooner? Is it insurance recommending that? That way they don't have to pay for it? I'm assuming that's part of the reason. But why is it not recommended to have it start younger?
So the research that a lot of the funding that American Cancer Society
Mhm.
gets in, actually, it's for research as well, so
Sure.
that we can research what are the best guidelines,
Mhm.
because the guidelines have changed.
Yep.
And we're happy to see those changes because that reflects the research that's being done.
Mhm.
It reflects the patients that are being treated and served and the data that comes from that. We use that data to inform future recommendations because we see the trends. We see, okay, this is kind of happening. When we think about like a PSA, a prostate specific antigen test, PSAs went away for a little while.
Mhm. Yep.
And in the 10, 15 years, don't quote me, okay, the scientists out there, when it went away, we're starting to see more prostate cancer.
Yeah.
So the PSA was looked at as like, oh, we don't want people to get too scared if their PSA is a little bit high. So they changed some of the guidelines around that.
Mhm.
And now, 10 years, 15 years later, we're seeing some of the impact of that. So the research is always driving what American Cancer Society is either recommending or what we're looking at.
Sure.
And it's that research piece of it, the data-driven research.
Makes sense.
I'll also add with the 45, with a lot of younger women getting diagnosed, we are seeing family history as well. So having an open conversation with your provider of if your mother had breast cancer or you had a great grandmother that passed away from breast cancer, making sure that you have that open conversation, because if you do carry a genetic strand like the BRCA gene,
Mhm.
you are more susceptible to getting breast cancer. And that is a research driven fact. So making sure that as you have those conversations with your provider, they have the ability to recommend if you were to get a mammogram sooner
Sure.
based off of your body type and your history.
Well, can you just ask for one?
You
Can you
can.
just ask your physician for one?
You
And
can.
should they give it to you?
It
Or
really
are they gonna fight
depends.
back a lot of
Sometimes
the
they
time?
do fight back. I asked for a full body scan, for example, and it's been 4 years since I first asked, and I still have not gotten one.
Yeah, you just gotta pay out of pocket, go to
No,
California for
like
that?
I said I'd pay out of pocket. They didn't schedule it. So I
Hmm.
probably could have been like, "Yo, dude, for real, like, let me get this done." But
Yeah.
Right.
like, it's not, "Hey, I want to get a full body scan just to make sure I'm good," and you get it. But I'm sure it depends on doctor. But at Mercy, that's how it was.
It would make sense to do that type of stuff as long as there's no
I don't know
long-term
why you wouldn't get a full body scan once a year.
insurance doesn't wanna pay for it.
Like X-ray and MRI, that
I
covers
think a lot of
most
it just
things.
goes back to insurance doesn't wanna pay for it, and people don't wanna pay out of pocket for it. I know in California they have, treatment centers that you can go in and do that and pay, and you could definitely get it done there. Alright, so a lot of it's preventable
Mhm.
just by screening. Now, is there anything that you guys talk about in terms of, fitness or eating or anything like that that plays a role as well?
Absolutely. So your lifestyle habits truly go into your susceptibility to getting cancer. So
Mhm.
if you're smoking, we all know that that does lead to lung cancer and other cancer variations. If you're drinking, you have a higher susceptibility. If you are not living a healthy lifestyle, such as eating or drinking, exercising regularly, those are all factors that we do consider when going into the numbers.
Sure.
And when you guys are going into the numbers, because we're reaching into, I'm no expert on this, but I've done a lot of research on radiation, and a lot of people, they hear the word radiation and they think nuclear bombs,
Mhm.
usually. However,
That's immediately
radiation
what
is
I knew
quite
exactly where you're going. Yeah.
radiation is quite literally given off by pretty much everything, and to some extent. How much research, if any, do they do on radiation coming off of devices, electronic devices, for example, and how that causes cancer?
I'm not aware of any research that's happening, but we fund researchers. So that's
Hmm.
also what American
Mhm.
Cancer Society does is
Mhm.
we try to fund people that are pretty early on in their cancer research because they're probably not getting funded from other major
Sure.
institutions. So we
Now,
try
is
to
that what
find them
you do for
early.
the most part, or do you guys also fund people that are highly experienced, some of the best researchers on cancer in a certain field of cancer in the world?
What I, that's I can definitely get back to you on some more of that kind of higher level research and how we, I guess, triage or tier some of the
Mhm.
research that's happening
Mhm.
because that is not in my wheelhouse.
Sure.
Sure. Sure.
But we can certainly get an answer to that.
Yeah, that's like phones, obviously there's a big benefit to not talking about it if you're a big tech company, and big tech companies are what control search engines. So there's not a lot of coverage on it, but just the fundamentals behind how radiation works tells you that it can cause cancer and also do good things depending on how you use it, obviously. But that's one thing not talked about a lot. Do you guys, how do you, and I don't know how much you guys know about this topic, but when it comes to in this day and age, if you look at the amount of people that get, I should say not the amount of people because population increases as time goes on, but the percentage of people that get cancer compared to 25, 50, 100 years ago, the percentage is ridiculously higher. And it's not just cancer, autism's, I think, actually a much worse number than cancer even. That said, how does that affect how the organization operates, and how do you guys even try to combat such large numbers of people getting cancers and various types of cancers and cancers being caused by an increasing number of things?
Absolutely. That's a great question. So, our whole motto, I'm going to say, is to end cancer as we know it for everyone. So, the cancer we see today is going to be potentially different from the cancer that we saw 50 years ago or 25 years ago. It's a disease that learns how to adapt to the body, and unfortunately, it just keeps growing and finding invasive ways to continue to spread. But what I will say is, based off of our investments in research, we have led to 4.1 million fewer deaths to cancer. So yes,
How's that measured?
That is a national measurement from our organization. So I'd be happy to give you more documentation on it. But we get reports every year that talk about it. It's a completely public report. It's called Cancer Facts and Figures. That is where I pull almost all of my numbers from. And that tells us what the estimated cancer diagnosis for the next year is, which so for 2024, it's about 2 million is estimated. It tells us even down into the state of how many cancer types of cancer, how many cancer deaths are projected. And so it does all of that based off of the data and research that we collect. We have, let me see, make sure I'm saying this correctly.
And when you say 4.1 million less, is that 4.1 million people?
Did you say million or billion?
4.1 million fewer cancer deaths from 1991 to 2024. So it is a combined
30,
year.
Okay, is that just worldwide in general, or is that 4.1 million less deaths during that time period because the American Cancer Society helped out, or what is that number caused by?
That is just in the United States, 4.1 million deaths, or fewer deaths. So we're promoting early detection and screening. So someone might get diagnosed with skin cancer, but they got screened earlier. So we were able to reduce the death rate on that person versus they didn't know about early detection and screening. So they waited 30 years and now they have melanoma. So it's different things like that. We do have specifically in breast cancer, we have 162 research grants for breast cancer across the United States. And that's not even tapping into the other cancers that we research. We focus on every single cancer, every single life. So if it's out there, it's probably being researched in some capacity of our form.
Yeah.
Now, are is the research being done at universities for the most part, I imagine?
All over. Yeah. So here in St. Louis, we actually have several researchers at Wash U. So I'm actually taking a tour of taking a group of survivors next week to go and research. Dr. Weber specifically researches breast cancer.
Very cool.
And so he opens his lab up to us all the time to say, this is what we're doing. This is the money that you guys are raising to support us is truly doing this work. And he shares his findings. He is phenomenal.
That's got to be good to see.
I'd be happy to take you guys on a tour if you guys ever wanted.
So you're saying that the powers that be don't have the cure to cancer hidden away, right?
Not that it's been found.
That's the fun conspiracy, right? They have the cure.
So yeah, I mean, we take people into our research tours all the time just to open it up, because people hear research and they think, oh, you're just throwing money into a lab, versus taking them to the lab. They can see the impact that they're making. Especially here in St. Louis, we are blessed with several researchers that are funded by us.
That's a tour I'd love to do.
So, and the research has
Yeah.
led to actual like strategies and treatments. Tamoxifen is a widely used treatment for your post chemo care, and it's something you take for generally about 5 years after your cancer treatment. And after that mark, you're generally considered kind of in remission. So, tamoxifen is a direct result of the American Cancer Society funded research.
Interesting. So that's something you take after the treatment.
Yep.
It is
Okay.
considered more in the preventative standpoint to try
Gotcha.
to prevent it from coming
Coming back. Got it. Interesting.
What
Okay.
does that do to prevent the cells from mutating? Do you know?
I have a
Gosh.
business degree. I did not.
Yeah, I don't have the science background to help
Okay, I
understand
was
the
just
tamoxifen
wondering.
aspect of
Yeah.
it. No.
So you guys fund a lot with the research side. So, and of course, helping prevention, screenings, things like that. But what about someone has cancer? Do you guys help with treatment costs? Do you guys help with transportation, wigs,
I'm
Like-
so glad you brought this up.
all of that? So what do you guys help for with people currently going through treatment?
No, that is a great question. And this is where we lean heavily into right now because not a lot of people realize the support options that we have. So we do have a program
Well, it
called
just feels like all the money goes to research. It's like there's people actually going through treatment right now.
Right.
It's like we could take care of those people as well.
And there is
Yeah.
there is a good breakdown that does say how much goes to research, how much goes to patient support programs. We are very transparent about our fundraising, and that 81% of the funds that we raise go directly back into the mission. So we
Nice.
are very passionate about that. We've achieved several awards that are very hard to get. But we have a program called Road to Recovery. So that is nationwide. That is a program where volunteers transport cancer patients to and from their appointments, to their treatments.
Really?
Completely free of charge to the
Interesting.
patient.
Okay.
So we are always looking for Road to Recovery volunteers, people that are willing to drive. So that is a program that's active here in St. Louis as well. We have Reach to Recovery, which is specific for breast cancer, but that pairs a breast cancer survivor with a breast cancer patient. And it goes based off of your age of diagnosis,
Yeah.
the type of diagnosis, the treatment that you're going on. We really try to get you to
It's a good
pair
idea.
as much as possible. And they're, in a way, your mentor to coach you through it. They get training from the American Cancer Society. They are not a medical professional, so they're really there to be your friend. The big one that we really have here in St. Louis, and Jamie knows what I'm about to talk about, is our Hope Lodge. And no one knows what the Hope Lodge is, and we're really trying to spread awareness of it. It's down in Central West End, and it is basically a hotel for cancer patients to stay for free for the entirety of their treatment,
Really?
as long as they're 35 miles away or more.
Is it a
from their-
cooperation with another organization?
It's completely funded by us. So Worldwide Technology
Lodge.
sponsored the building, and it is a great program. So someone, let's say someone in Nebraska has to come to St. Louis for chemotherapy treatments. They get a referral from their physician or their caseworker, and as long as we have capacity and they meet the qualifications, they can stay for. I mean, we've
How
had
many
people
rooms
stay.
do you guys have there?
42?
42?
I believe 42 rooms.
Awesome.
And like the average day, someone could be there for a year.
Really? Okay.
And they
There is
might
no
come in.
limit.
Yeah, there's no limit. They can come in, do their treatment during the week. A lot of them will go home on the weekends.
Sure.
But then being able to stay there, and it's a beautiful hotel. Like it has 6 amazing kitchens that you can cook in. They've got refrigerators so that you can store your food.
Nice.
And it's a great way to just sit with other folks that have had a long day in a cancer center and either just break bread with someone, or just be around other people, but not have to talk necessarily, but you
Yeah.
can still be sharing dinner together. A lot of outside organizations will also push into the Hope Lodge to provide meals, to do bingo games, to do arts and crafts. And I know we've recently secured some donations to like basketball, baseball games. Some other like
Yeah,
events.
maybe if we got a
uni.
basketball team, I'd pay attention.
Right.
I'm just putting it out there. I'm
Until-
just saying.
Yeah.
I'm saying we need the basketball,
Yeah.
right? But just events so that when they're here, it's not just going to a cancer center, coming
Yeah,
back to
coming
Hope
back,
Lodge.
yeah.
Yeah.
There's some other activities as well. But Hope Lodge is amazing. And in Missouri, we are very fortunate that we have 2 We have
I was
one in
gonna
St.
say,
Louis and
is
we have
there
one in Kansas
is
City.
there multiple around the United States?
Yes, so there's
Okay.
I think 12.
Oh,
They're very limited. We
Okay.
are, and so that is something that we have fundraising campaigns in
Okay.
different states that need Hope Lodges to
Mhm.
try to get them Hope Lodges. We
I
are
think they're trying to build one in Chicago, actually.
I've heard through the rumor mill that they are trying to build one in Chicago.
Yeah.
And areas in the Northwest, the Northeast,
Mhm.
areas that have large cancer centers that
Sure.
people are going to. So St. Louis is one of the bigger ones because we have so many cancer centers like Siteman and
Mhm.
Washington University.
Yep.
But it is a great program. And so we try to volunteer pretty frequently as staff members. We try to go up there. And it really reminds you of the mission when you're
Mhm.
talking with someone that's actively going through treatment, actively utilizing the services
Yeah.
that we provide. It makes it so much more meaningful.
Yeah. My great uncle is going through cancer treatment right now,
Mm.
but he's 80. We just had his 80th birthday party at the winery this weekend. Should be good for at least a little bit.
And your
little bit
dad
longer time.
is a survivor too, correct?
Yeah.
wow.
Oh,
Yeah,
wow.
thyroid cancer.
Wow.
Well, I think it was throat cancer, but he had a massive thyroid. They had to cut it out. He had a nasty scar.
Mm.
I remember seeing him in the hospital. They had these big staples holding his neck together. Not to
Oh,
get
wow.
goodness.
Yeah, I got
not to get a little gruesome, but
Yeah,
it was like I was like, wow, those are like industrial staples.
That's
And
Yeah.
I was like,
I had
That's
to get the
gross.
same thing done. They yanked one of the lymph nodes and did a biopsy on me. Remember that? That was not fun.
yeah.
You can't move your neck.
Yeah.
I need to get I'll have to send the picture. I have a picture of it somewhere of my dad's.
No, his was probably way worse.
His was like they cut him from here like all the way down here.
Oh, I can
Wow.
only imagine.
Yeah.
And
So
yeah.
it was
It
my
gets-
mom had to put like rub stuff on. I was
Oh,
like, it's like this is gross.
That's real love right
But
there.
Yeah.
he doesn't have
That's
he
a
doesn't-
true caregiver.
Yes.
I guess you're always in remission, right? It's not like you're
Mhm.
never cured.
Now-
Has anyone ever had cancer and then they're like, you're cured? Or is it always remission? I don't think, is there a type of cancer where it's like, you're going to be good? I'm
Well, no,
probably a
'cause
stupid question.
even if it was 100% gone, then cancer can
It can
Come
always
back.
come
just
back.
happen for a different reason.
Yeah.
Mhm.
Okay. All
My
right.
grandma is also she's since passed, not due to cancer. My grandma battled with breast cancer for many, many years.
Well, and since we're talking about our family members and caregiver was mentioned, American Cancer Society also has resources for caregivers because
Interesting.
we
Okay.
understand that caring for someone with cancer
Yeah.
can come with its own health issues.
Full-time job. Yeah.
Because you neglect your own health. You
Mhm.
sometimes neglect your own needs when you're caring for someone that's going through active cancer treatment. So American Cancer Society recognized that there's a caregiver and there's also a cancer patient. So
Mhm.
we have resources for both as well.
Yeah, that's the tendency of people who tend to put others first and take care of other people is they're
Yes.
not meeting their own needs.
Yeah.
Yes.
In,
I'm
in and
guilty.
outside of caregiving.
Yeah, and if you aren't taking care of yourself, then you can't really be
You can't be
a
as good as
full
you
functioning
can.
caregiver
Yes.
Mhm.
as you want to be.
Correct.
You can't help others till you help yourself.
Yeah.
Yes.
Hey there, St. Louis podcast listeners. We've got some exciting news from our friends over at Farmers Insurance of St. Louis, led by the man, the myth, the legend, Mark Lee of Farmers Insurance.
Mm-hmm.
If you're looking for a job or to own your own business under a brand that everyone and their cousin is familiar with, Mark Lee with Farmers Insurance of St. Louis is recruiting insurance agency owners here in St. Louis for their Farmers Insurance Mentorship Program.
And as many of you are aware, Garrett and I have owned quite a few successful and award-winning businesses over the years. And in a past life, one of those was a farmers insurance agency out of Chesterfield, Missouri.
Eric and I know firsthand how hard it is to start a business under a brand that no one has heard of and convince consumers and businesses to trust that you're an authority figure in your industry.
And as many of you know, we own an award-winning marketing firm, Vi Media, the one that Garrett was just discussing. And building that company's reputation literally took years. We're still building it to this day, and it's been 8 years in the making. However, with the Trusted Farmers Insurance Agency name on the building, we got started when we started our Farmers Insurance Agency. The trust was already built and has been for 96 years.
And if you can't do math, that means Farmers Insurance has been around since 1928. Luckily, you don't need to be a human calculator to get rich as an owner of your very own Farmers Insurance Agency.
Nope. All you have to do is reach out to the one and only Mark Lee, the leader of Farmers Insurance in the greater St. Louis metropolitan area.
That's right. So ensure he continues to sponsor our show and your favorite podcast, the St. Louis Podcast, by quitting your job today and calling Mark Lee. I wouldn't even wait for him to answer your call. Call your boss now, quit, and become your very own business owner.
Visit insurancecareerstl.com. That is insurancecareerstl.com. Should we spell it out?
Yes. It would
INSURANCE, career, CAREER, STL.com, insurancecareerstl.com. Go there now. Back to the podcast.
And wait, insurancecareerstl.com.
Back to the podcast. Okay, so we got the transportation. We have the lodging. Now, what about actual treatment itself?
So this is where we really do work with our community because there are so many people in the St. Louis community that are doing that work. We don't want to duplicate the work or stand in a place that someone's already standing.
Yeah. Yep.
So there are amazing community organizations in the St. Louis area, and I work in Kansas City as well, but in that area also where people are meeting the cancer folks right there with the prescription money, with addressing those barriers to care. Now, this year, American Cancer Society did recognize those barriers to care that everyone is going to run into, because if you're paying for active chemo and cancer treatment, then you're looking at what groceries you can buy, or if you can pay the power bill, or some of those other factors. So American Cancer Society worked specifically with community-based organizations to have addressing barriers to care grants.
Gotcha.
So these community organizations were able to apply for grants because that community organization knows who it's serving. They understand the community. They're already working with folks, so they can get the dollars in the hand a lot more quickly than trying to run it through like a cancer care center or through a large organization like American Cancer Society.
Makes sense.
So relying on those community partners and working hand in hand with them is really how we're meeting all of the needs.
How do you make sure that those community partners are doing the right thing?
Okay, well, we have a lot of trust in our nonprofit. And then there's also the data sharing. So there's always budgeting,
That's going to be one of my
the data sharing, like the numbers. And then there's lots of approval processes. Like this is the plan you have to address the barriers that you're seeing. And then they work with our teams to make sure that everything is, the initiatives that we're trying to implement are researched. And there aren't just things we're trying to throw against the wall and see what happens. These are things that have been proven to be effective.
Yeah, because that's a big thing with, I guess, larger organizations is, it's like we're going to throw, maybe a little bit of money to them, but it is still a large amount of money at something. And obviously not saying that's the case with you guys, but with, large organizations, they have the tendency to, put money in the wrong place, or not ensure that money's going to the correct place and things like that. So it's always good to make sure that if the money is going somewhere, that's actually getting into the right hands, because I think that's the biggest thing with really not-for-profits in general, right? Because we know there's plenty of cancer organizations where only like 10% of the money, I give them $1, only 10% is actually going to someone that's affected by cancer.
That's actually been the case with the American Cancer Society a long time ago.
Was it? I don't know. But
they've since increased it a lot. I think she
said 81%.
81%.
Yeah.
Which is comparable to others, very high.
Yeah. I know there's a ton. I looked at the list a couple of years ago, and there's some that was like 10, 20% that I know are like a lot of people don't know, and they send money to them. I'm like, they're literally they're pocketing like 90% of all that cash you just gave them, which is crazy.
For a lot of people, the smaller ones are tax havens. I had two questions that to help build trust in American Cancer Society, and one of them's, whenever someone does donate and that money goes towards research, and let's say it makes it the WashU, how involved is the American Cancer Society and what happens with the end result of that research? So say WashU makes a discovery, for example. Do you guys know what happens? Like, do they have to report back to the American Cancer Society before they're able to actually pass that out and it becomes a treatment?
So that's still more on the research end of things. So let me speak directly to some of what happens in the community and how we're helping folks, because the research is driving the treatments and some of the recommendations.
Mm-hmm.
But how are we
It's the long
actually
road.
Yeah.
helping folks? So like Washington University, I have a project with them right now where they have a mammogram van that goes out into the community.
Mm-hmm.
But we're trying to double down on the screening that happens in a mammogram van,
Yeah.
because we know that a lot of women will help take care of the health needs of the men in their life.
Mm-hmm.
So we started adding prostate cancer screening information, and then we're also adding colorectal cancer screening. No,
Smart. Yeah.
everyone needs colorectal cancer screening.
Mm-hmm.
So adding it to the mammogram van for the women that are already there and already invested in their health by coming to get a mammogram, we're also reminding them you're not done
Yeah.
with just this mammogram. There are some other screening opportunities. Now, screening is scary because if you don't have a plan for after you've been screened,
Yeah.
it can be real scary. So this is a lot of the reason why folks that are maybe uninsured or underinsured,
Mm-hmm.
they sometimes avoid the screening, because what am I going to do if I go get a mammogram and it turns
Right.
out that they see something?
Yeah.
I don't have the means, the insurance, the opportunities to address this.
Nor did
So-
they mentally prepare probably.
Exactly.
Right.
So
It
the
is a
money
shock.
that we're trying to use is to link them to care,
Mhm.
because a federally qualified health center will give you a screening. But when you have a positive colorectal cancer screening test,
Mm-hmm.
you need a colonoscopy.
Yeah.
Colonoscopies, if you don't have insurance or are underinsured, are a lot of money.
Yep.
And a lot of times they can't even tell you what it's going to be.
Yeah.
So you avoid it
That's-
completely. I'm like,
that's-
I'm not, that's
That's
an unknown
interesting,
bill.
right? How much is this going to cost?
We don't know.
Exactly. So
Some
we
number.
actually are funding and working with programs to make a link to care, so that we have found a GI doc that has said, I will give you my time,
Yep.
and then I will do this colonoscopy, and then we can offset the cost of the anesthesiology or some of the other pieces through this grant work.
Mm-hmm.
And then we work with Washington University and their quality improvement teams to make sure that everyone is being identified that could benefit from a link to care program like this. So again, it's really relying on our community partners and working with them, because we can't be every place, everywhere, all the time.
Yep.
But our community partners are there. So we want to work with them, give them the funds to do some of the screening projects, and then link that care that's needed.
Gotcha. Makes sense. So I'm curious when it comes to the bills side, right? Lobbying side. Do you guys do anything on that front in terms of trying to push it forward?
It's almost like we sent you a script and told you to ask all these questions, which we did not.
Well, I'm just good at my job.
Yeah. There you go. So we do. We have a program called ACS Can, and their whole organization is in charge of. They're in the House of Representatives. They're with the senators. They are lobbying for policy changes. They're lobbying for additional government funding.
Yep.
So we have 2 people on the grounds in Columbia, Jefferson, Missouri, and they are constantly working with our lawmakers to see what they can do to change and make care more accessible, to make care more affordable, constantly looking at those different aspects.
Do you know anything specifically anyone's working on right now?
They just,
Either nationally or state?
locally, they just told us about some, which, I'm going to totally stumble over my words.
The last I heard was the health insurance bill.
That's
down
what
in,
that's the one.
so
that I
the
was talking
farmer,
about.
like farm bill, not farm bill. Oh goodness, some farming organization was trying to create a health plan
Interesting.
for local farmers. And ACS Can was trying to make sure everyone truly understood what was going to be involved in if they signed up for that health plan, because it's not a traditional kind of health plan in terms of covering pre-existing conditions. Just some of the small print. Our ACS Can representatives wanted to make sure that everyone fully understood what was being put in front of the House and how American Cancer Society felt about how that bill would support healthy communities.
So what was the real point of the bill then? Were they trying to do something good and didn't understand, and then they went to a provider, and the provider
Assuming
Was
positive
there-
intent, absolutely.
was
I
there
believe,
a provider that was the one that was writing the fine print?
Oh, I don't know that. That's a
Okay.
level of detail I
Okay.
don't have.
Yeah, because I'm curious if it was, it's not the state doing it, right? So they have to. Some sort of provider has to be providing that. the health services, I would assume.
I don't know enough about that to
Okay.
really speak to that
But
other
it sounds like it
than
wasn't going to be good in the long term for the farmers.
that's how ACS Can felt about it. That was our stance.
Sure.
That we wanted folks to truly understand what is and is not covered if it were to pass. So that's how I really look at like our Can, as being an advocate.
Yeah. Yeah.
Like truly advocating for the community and healthy decisions that will impact the community.
So curious, I don't know if you know the answer, but what would be better for the farmers instead of doing that route?
Oh man. Well, can we get back to the questions we sent you? That felt like a real hard question.
I did want to reverse real quick
Yeah,
and ask
yeah.
something that we probably should have asked at the beginning, would have given us more context. How long have you been at American Cancer Society?
I've been there 2 years.
2 years.
I've been a breast cancer survivor since I was 29, so
Okay.
I'm 47 now.
Got it. How about you?
I just joined the American Cancer Society in October of last year, so I'm coming up on my 1 year anniversary.
Okay.
Yeah.
How do you guys like it so far?
Amazing.
It's the best job I've ever had, and I say that not because I'm here as a representative. I've
Or
had
because there's cameras rolling? Yes, I understand.
We're live.
I have had jobs that I love or enjoyed. I have jobs that I've not enjoyed, and for the first time, I can truly say that I love my job. The people that I get to interact with are volunteers. We have over 1 million volunteers, so we're a volunteer-led organization. The volunteers, I was on a call with 2 this morning, and the first 15 minutes of our phone call, I was just asking how their husbands are doing, how are their grandkids. They're asking me how life is, and we really create some genuine connections over something that's not so great in someone's life.
Well, there's something the audience can actually learn and take action on if they want to. You said they have over 1 million volunteers?
1 million volunteers.
How heavily involved are some of these volunteers? I'm sure there's a spectrum, but like on the, very involved, and how involved do they get?
It really is how much you want to get involved. So specifically working with me, I have a group of committee members. So they are planning the event with me, the Making Strides Against Breast Cancer. They are on the ground roots, asking people for sponsorships, asking people for logistics planning. So they are really my right-hand group of people. We have some people that come out day of for our Relay for Life events or our Making Strides events, and they'll come volunteer for a few hours. There's some people that are kind of in between. They want to be involved, but not to the point of almost being an employee, but also not to the point of only showing up for a few hours on the day of. So
I also want to talk about being a volunteer for Portrait of Hope.
Yeah.
So I am
What's
a Portrait of Hope. So I'm a Portrait of Hope volunteer. I'm
Okay.
someone that has survived breast cancer, and I want to be a portrait of hope
Got
for
it.
other folks that are diagnosed with cancer.
Got it.
So this is a volunteer capacity, and this is probably the coolest volunteer thing I get to do.
it is highly selective.
Yes,
Is it
you have
part
to
of the
apply.
American Cancer Society?
It is local to Making Strides Against Breast Cancer here in St. Louis. So
Okay.
it's a program that we started several years ago. We have several Portrait of Hope alumni, and now it's being kind of rolled out nationally because of how much.
But it started
positive
here in
feedback.
St. Louis?
It started in the Midwest, and I think St. Louis is one of the ones that really took off with it.
Said
Understood.
Ed Massey and Bernie Massey founded it. 95. Unless this is a wrong one. I
I think
this
that's
is
something different.
Oh, is it?
I think it was a staff member.
Portraits of Hope.org? That's not.
That's different.
Yeah.
Okay.
No, because this is
So
a part of the American Cancer Society.
But a Portrait of
Portrait-
Hope
okay,
allows me
there we go.
to
I
get
found it.
pampered. I had a photo shoot. We go out to lunch, and we really get to kind of hang out with other ladies that have survived breast cancer, and we talk about our experiences, our treatment options, just
Is this a woman only
I think I
thing?
saw this.
It is not.
Okay.
So it
because
is
men do get breast cancer.
and
Yes.
it's
Yeah,
not limited to cancer survivors. So we have caregivers that come and talk about their story. So really what it is it's an opportunity to share your story with breast cancer in the community. So those are people when we have a great partnership with Fox 2. So when Fox 2 is looking for an interview, I'm not going to go and talk because I can't share my story with breast cancer, but Jamie can. And so it's really leveraging the different experiences because cancer looks different on every single person. It's showing, when we have 5 diverse women or 5 diverse men or caregivers, a mixture of that, it shows that just because you don't think you're going to get it doesn't mean you can't get it.
Yeah. So let's say we're 10 years from now. Do you see any hypothetical medical breakthroughs
And if so,
in cancer or anything? Yeah.
And I was going to add on to that, and if so, and maybe you guys haven't been exposed to this, but if you've gone around and gone to WashU, for example, did a tour there, what are people within the organization talking about as like the leading thing that people are excited for in regards to breakthroughs?
It's a great question. I am not equipped enough to fully answer about the breakthroughs.
Sure.
I try to read the research as much as I can. I
We're
try
just
to
we're just
understand it.
curious guys over here, you
I
know.
know. I will say that we're trending in the right direction.
Yeah.
We do see that the impact that we are making, it is making an impact. We
Mhm.
are seeing fewer cancer deaths every year, but that's not to overcast on the fact that people are still getting diagnosed with cancer.
Yep.
I mean, just here in Missouri, we have about 5,480 cases per day. So in the time that we do this podcast, diagnosed
Per day
per day.
in Missouri.
In Missouri.
5,400?
5,400. So in the time that we have sat
That's a
here at
lot.
this table,
That's a lot.
240 people have heard the words "you have cancer."
Yeah, it's the
Every
leading cause of death in the U.S.
Yeah. Yeah. Makes
so it
yeah.
we're not here to downplay on the fact that it's not
No, heart
happening.
disease,
It
sorry.
is.
Lung
But
cancer.
you know, hearing the words "you have cancer" is
Mhm.
something that is going to change someone's life. So we're here to figure out how
Do you
can
guys
we
have like a
reduce that.
hotline?
Yes, we do. So
Okay.
we do have a
Because I was just
hotline.
thinking, I was like, if I got the news I have cancer,
Mhm.
I was like, who am I gonna call? I was like, I don't know who I'd call.
It
Like
is
I'd almost
a
call like a hotline to
The
talk to.
better question is who would answer, you know?
Damn.
We will answer.
That's
We
right.
will
You call us
answer.
and we will
That's
answer
right.
There's a
you.
hotline.
That's
That's
right.
right.
The hotline is great. It's a 1-800 number. I
Okay.
will provide that number to you, or unless you have it off.
I think I have
I never want to say the wrong digits.
1-800-227-2345.
I'll
Okay.
send
And
that
that
to
is
you
a
for later.
24/7 operation. They're open even on Christmas, New Year's Day. It is based in the United States. You are going to pick up the phone and you're going to get a person.
That's
And
awesome.
that person is going to be compassionate, empathetic. Monday through Friday, 8 to 5. We actually have medical professionals on the phone too. So we've had college kids call up and say, hey, I need some data for a report that I'm
Yeah.
doing on cancer. And they'll provide it to you. You can call and you can say, I'm just having a really bad day.
Mm.
And they will walk you through that. I have heard calls of someone calling. They had just gotten an inconclusive screening and they didn't know what it meant. And
Yeah.
so they provided them the resources they have bounds and bounds of local resources that are in your community, and they will get you access to the different things that you need. In addition to the 1-800 number, a lot of people are like, oh, a hotline, I don't want to call that. It can truly be life-changing if you make the call. But we also have cancer.org, and that is a website that is visited probably hundreds of thousands of times per day, millions of times per year.
Mm-hmm.
And that is anything and everything cancer related is going to be on that website. So, you know, for example, I have an autoimmune. I'm more susceptible to non-Hodgkin's lymphoma. I get tested for it every year. But I one day was just like, what signs and symptoms do I need to look for so that way I can be proactive in my care?
Mm-hmm.
And I just searched non-Hodgkin's lymphoma and it pulled up everything that I needed to know about the cancer.
Yep.
What the treatment type is, what the preventative,
That's what they
screening
thought I
are.
had.
And so any question about cancer, anything about our fundraising, where you want to know where the money goes, it is all on cancer.org.
So, got a couple minutes left. Before we get out of here, let's educate the people. If someone wants to get involved and help you guys, if it's just money or if it's actually, taking their time out of their day and volunteering, what's the best place for them to do that? Where should they go?
They can contact me directly.
Okay.
So my email is avery.starnes@cancer.org. My contact information is also located on our Making Strides Against Breast Cancer website. So phone, email are all
We'll have
on there.
link in the description.
Yeah,
too, so.
they can always contact me there. We have several different events within the community. So if they're ever attending one of those, they can always reach out there as well.
How often do events take place and where do they usually take place here in St. Louis?
We are kind of spread out throughout the year. So we have two different event types. So we have kind of our distinguished events. So a golf and a gala, golf tournament gala. And then we also have our community events. So I'm on the community team. So our focus is really getting into the neck of the woods of someone that hasn't ever really been exposed to the American Cancer Cancer Society.
Yeah.
We have 2 events in October, so Making Strides Against Breast Cancer. And then we also have a program called Men Wear Pink. And so that is men sign up, they wear pink or some form of pink. I see you're wearing the pink.
I got pink on my shirt too.
You're a perfect candidate for it.
My other
then.
pink shirt was dirty today. I meant to wear my fully pink shirt, and it was dirty. And
The
I was
little
like,
touch
damn,
is nice.
damn.
So they sign up, they raise awareness throughout the month of October, and they fundraise through their community. We also have in December we have the Coaches versus Cancer Holiday Tournament. That's a youth sports event. We have the All-Star Game. So we kind of go in batches, but those are kind of the 4 things.
And
that
I
we have
did want to
coming up.
highlight one of them because we talked about it before the show. For the audience, she mentioned the Making Strides Against Breast Cancer of St. Louis event, which is a fundraising event to bring the St. Louis community together to help end cancer as we know it for everyone. And it's a family-friendly event, non-competitive walk at Union Station on October 19th, 2024. And again, that's the Making Strides Against Breast Cancer of St. Louis event put on by the American Cancer Society.
Yep. So
Correct.
if you have one piece of advice for someone that just say got diagnosed or is going through cancer treatment, how you guys can potentially help them, and then also one piece of advice for like a caretaker or someone that is taking care of someone that's going through cancer.
Do you want to take the caretaker
I
one?
say I'll take the caretaker.
Okay.
Yeah. You're not alone.
Mm-hmm.
Like, you don't have to do any of this alone. You need a break for yourself. You need a network of folks. And American Cancer Society can be at least your first step towards finding a network of folks, finding some support at the level that you want it, whether it's virtual. If you'd like to meet with a support group, we can certainly connect with partner organizations that are having these support meetings because it is so important to care for yourself as a caregiver.
Awesome.
For anyone that's, recently been diagnosed, again, you are not alone. There are millions of survivors that surround you, but be vocal about it. Share your story, share what you're going through because people are going to be knocking at your door to help. And you don't have to do it just through yourself. Call us, call the 1-800 number, reach out to a local American Cancer Society office. We are actually literally across the street from you guys.
There we go.
We're in City Place. And
Yep.
Do you know how many offices you have in the United States?
I don't know how many offices we
It
did
said
have.
like 250.
We
I
had
saw
a
on the
lot
website
that
somewhere.
closed after COVID.
Okay, yeah.
But there are local, we're in every single state. So there's going to be a representative that is able to meet you from every single state. But just reach out. You don't have to go through it alone. Like Jamie said, this is a big process. It is a life-changing process. But just make sure that you are utilizing the community that wants to surround you.
And I know firsthand that most caretakers and cancer survivors, victims do go it alone and don't reach out to
Many
anyone.
don't like to talk about it. And it's not something that should be taboo because the more that we talk about it, the more that there's education and awareness spread out about it. When I first started this job, I hated saying like, oh, I talk about cancer all day. And now if I pin you down, we're going to talk about cancer. We're going to talk about when the last time you got screened was, because if you didn't get screened, then so we might need to have a conversation after this. But
don't ask me.
And then,
you have to talk about it.
Yeah.
I wanted to ask if I can plug one small thing. Since we've talked a lot about research and how dedicated American Cancer Society is to research, I wanted to mention a new research study that American Cancer Society just launched in May. It's called The Voices of Black Women. We have done studies in the past. This is not a clinical trial. So medicine is not being given or withheld. This is just a research study where we're trying to find information about Black women, where they eat, what they use on their body, on their hair, where they go, where they travel, just to help us understand if a different cancer recommendation or screening recommendation needs to be made. We need to know more about Black women's lived experiences.
Due to the lifestyle differences that could be there, that could cause cancer of different types?
We don't know what's there. This is why we're trying to find out what's there. And it is a longitudinal 30-year study.
Okay.
It has 2 touch points throughout each year.
How long are we into it?
It started in May.
Okay.
So
It just
2
started in
months.
May. So we haven't even recruited the 100,000 Black women we're looking for right now.
Okay. Okay.
So in the Missouri area, I think we're looking to recruit just under around 3,000 Black women. So if you yourself are not a Black woman, you can still certainly help by sharing this information
Yep.
with anyone in the community that you know of. You can go to cancer.org and search for voices, and then it'll take you to the page. There's a QR code. It's as simple as just scanning the QR code, and then you're able to participate in the research if you are a Black woman, to help us understand what recommendations might need to be made in the future.
Yeah.
Yeah, and we have, I believe, out of all the big cities, we have the largest, if not one of the largest, African American populations per capita.
And that's one of the reasons why only select states were selected for this program to start off the pilot of it. And that's one of the reasons why Missouri was selected, was because there is research that does show that we have a population that can be helped.
Yep.
And I think the qualifying, you have to be 25 to 55, and you couldn't have had cancer previously before besides
Basal or squamous, which is skin cancer that is survived.
Yeah, so you couldn't have ever gone
But
through
people
cancer
can apply
treatment,
to join the program.
Yes.
And if you are a cancer survivor, you're like, man, I want to do this, but I've had cancer, or I'm above the age of 55 or under the age of 25, you can be an ambassador. Now, ambassadors get a really cool t-shirt. So if you like free t-shirts, it's amazing looking.
What brand, though?
Oh, man. It's beautiful. It has the voices of Black women on the front.
I think it's a Gildan, though.
Hey, there we go.
I don't know. I was avoiding that. But it's an amazing opportunity for you to also be engaged in voices if you yourself are not eligible based on whatever the criterion is. You can still be an ambassador for this amazing research study.
Yeah, that's something that would actually be cool to share out if we get the information.
Yep.
We can absolutely send that over to you.
Well, that's all the time we have for today. Anything else before we get out of here? Wrap it up?
Thank you so much for this. Thank you.
Thank you.
It's been a pleasure. All right.
No, we're good.
That's all the time we have for today. However, we will be back next week with a new episode, new guest, and more of myself here, and potentially Garrett. We'll see.
I'll be here.
There we go. Garrett next week. If you're watching live or later and you like this content, you think more people want to see it, please like, review, share, subscribe. I combined multiple words there. And, show us some love here. Finally, we recorded this episode at halfcoaststudios.com. halfcoaststudios.com. That's the website. We recorded at
We're
Half
not
Coast
in the
Studios.
metaverse yet.
If you're in St. Louis looking to record a podcast, you can hit them up, halfcoaststudios.com. If you record a podcast yourself and you just need some help with editing or distribution, they can help you there as well. All right. It's been a pleasure talking with everyone today.
Thanks for coming.
Again, thank you guys for coming on, and we'll see everyone next week. Thank you.
Bye. Hey there, St. Louis podcast listeners. We've got some exciting news from our friends over at Farmers Insurance of St. Louis, led by the man, the myth, the legend, Mark Lee of Farmers Insurance. If you're looking for a job or to own your own business under a brand that everyone and their cousin is familiar with, Mark Lee with Farmers Insurance of St. Louis is recruiting insurance agency owners here in St. Louis for their Farmers Insurance Mentorship Program.
And as many of you are aware, Garrett and I have owned quite a few successful and award-winning businesses over the years. And in a past life, one of those was a farmer's insurance agency out of Chesterfield, Missouri.
Eric and I know firsthand how hard it is to start a business under a brand that no one has heard of and convince consumers and businesses to trust that you're an authority figure in your industry.
And as many of you know, we own an award-winning marketing firm, Vi Media, the one that Garrett was just discussing. And building that company's reputation literally took years. We're still building it to this day, and it's been 8 years in the making. However, with the Trusted Farmers Insurance Agency name on the building, we got started when we started our Farmers Insurance Agency. The trust was already built and has been for 96 years.
And if you can't do math, that means Farmers Insurance has been around since 1928. Luckily, you don't need to be a human calculator to get rich as an owner of your very own Farmers Insurance Agency.
Nope. All you have to do is reach out to the one and only Mark Lee, the leader of Farmers Insurance in the greater St. Louis metropolitan area.
That's right. So ensure he continues to sponsor our show and your favorite podcast, the St. Louis Podcast, by quitting your job today and calling Mark Lee. I wouldn't even wait for him to answer your call. Call your boss now, quit, and become your very own business owner.
Visit insurancecareerstl.com. That is insurancecareerstl.com. Should we spell it out?
Yes. It would
INSURANCE, career, CAREER, STL.com. InsuranceCareerSTL.com. Go there now. Back to the
Yes.
podcast.
And wait, InsuranceCareerSTL.com.
Back to the podcast.